All right. Good morning, everyone. Um, my name is Camila Fernandez, and thank you all for joining us for today's event. This session is aimed to giving housing providers and developers a sort of foundational understanding of the needs and barriers that people impacted by the criminal legal system face upon reentry. And we'll also discuss what a good community and industry coordination can look like in this space, and what opportunities housing providers can take on to better support this population. So for today, we're starting off with a presentation, then we'll have a panel discussion, and we're ending also with a presentation. And this first presentation that we want to touch on today, it's kind of to give folks a big picture understanding of kind of what the criminal legal system looks like and who's affecting in this country. And so to start us off with a more sort of national understanding of the impact, at the end of 2020, there were nearly 2 million people living in prison or jails in the United States. And it's estimated that 3 times that many people, so 6 million, live under correctional control. And this is in addition to the 5 million formerly incarcerated and the 100 million that live with a criminal record in this country. So in other words, what I want to highlight is that nearly 1 in every 4 American adults has a criminal record. And for every person incarcerated, there's a family and community-wide impact. Recent studies suggest that 1 in 2 adults have an immediate family member that has been incarcerated. And when we talk about children, half of the children in this country have a parent with a criminal record. And now taking a look a little more about who is it affecting, we know that low-income adults are more likely to be arrested and more likely to be charged with crimes that carry longer sentences than adults with higher incomes. A study by the American Action Forum, they found that adults in poverty are 3 times more likely to be arrested than those who aren't. And people earning less than 150% of the federal poverty level are 15 times more likely to be charged with a felony than people earning above that threshold. And by definition, felony carries a longer sentence. And now applying a racial lens into this system, we know that people of color, particularly Black men, and also Native folks, are overrepresented in our prison and jails and are more likely to be policed and arrested compared to a white person. And this is driven by the discriminatory policies and the discretionary processes that have been used in the US and the criminal legal system. And this ranges from the disparities that exist in policing practices through bail decisions to disposition to sentencing to parole and to parole determinations. And so this discrimination has been consistent, has been pervasive throughout the history, and it shapes what our current criminal legal system looks like and who's affecting. And with that, I'll pass to my colleague Emma Cathell, and she'll give you now a broader sort of understanding of how this looks like in New York State.
Thanks, Camila. Hi there, I'm Emma Cathell, and I am here with my colleague Lauren Velez as well from CSH. If you are on camera and would like to...
I'm here, Emma.
Oh, there she is. Hi. I'm going to pin you as well. There you are. Hi, Lauren. I'll pass it to you.
Alrighty. So hi, everyone. I am Lauren Velez, and I work at CSH with Emma Cathell. And we wanted to talk a little bit about, mostly about a report that we did around how we can use supportive housing as an intervention for folks coming out of Rikers, so that we can kind of help end the cycling that we know folks do when they are struggling with mental health, also struggling with homelessness, and then being released from incarceration. And folks tend to just kind of cycle through crisis systems, and supportive housing is an intervention that can really help stop that cycle and get folks the services and stability that they need to re-enter their communities. But first, we wanted to talk a little bit about something called our RDDI, which is our Racial Disparities and Disproportionality Index. And it's a tool that CSH had developed to look at the differences in outcomes across a number of different factors based on race. And the way that we did it kind of decentered whiteness as the comparison that everybody was going through, to really just look at how each different group is being impacted by different things. So as you can see here, looking at the indices in New York by race and ethnicity, and looking at chronic homelessness, as compared to, even certainly as compared to their white counterparts, Black folks are much more likely to experience chronic homelessness, non-chronic homelessness, veteran homelessness, family homelessness. So in basically every single category, it's having a larger impact on minority communities, in particular Black folks. So just want to, kind of use that to help frame the discussion and set the stage and foundation around the fact that we know that these outcomes are impacting groups in very different ways, and really just like kind of, acknowledging that Black and Brown communities are being more impacted by these crisis systems than any other group. You can go to the next slide. Okay, so Emma, do you want to, would you mind putting the full report in the chat so that folks could access that if they like? Thank you. So what we're going to do in the next couple of slides is just kind of highlight some of what we think are like the main takeaway points from the report that we did. The full report was released back in February, and Emma will put a link in the chat. So if you're interested, you can take a look at the full report. But this is looking at Rikers in particular and the number of admissions that they had in 2020. So there were, over 13,000 unique admissions in 2020, but nearly double that for the total admissions. So seeing that folks are going back, right? If we've got 23,000 admissions, but only 13,000 of them are unique, means that that same population is showing up again in their system. And on average, they've got just under 6,000 people in their kind of daily population. So the two numbers at the bottom, that the average stay for the general population at Rikers as of January 13th, 2022, so pretty recent, was 222 days. That's a pretty significantly long stay. But when we look at the average length for the Brad H population, which is essentially folks that are incarcerated and also have a serious mental illness, it is almost 1 full year. So 357 days, literally just shy of spending a full year as their average length of stay. And we know that when we're looking at homelessness and how folks are prioritized for supportive housing interventions, they typically need to meet the definition of being chronically homeless in order to qualify for these housing units. However, due to a HUD standard, if anyone is in an institutional setting for more than 90 days, they essentially lose their chronic homeless status and have to begin that clock all over again. I'm going to back up a bit because I realized that I didn't give the definition of what it takes to meet chronic homelessness. But essentially, you have to have experienced homelessness for 12 months or longer. So that could be consecutive or broken up over 4 times in the last 3 years. But it has to be 12 months of unsheltered homelessness that is documented. And you also have to have a diagnosed disability. So it's a pretty extensive definition. It's a pretty lofty thing to meet. So folks have to have gone through it to meet this definition, right? Now, if somebody is incarcerated or even in a hospital for 91 days, they lose that entire chronicity history, and that's the clock that has to start over again. So someone could essentially be homeless for 7 years, enter into a carceral system, and on that 91st day, they have to start that clock all over again. So it's not like they can be released and it's like, okay, you've got 7 years of previous homeless history that we can count towards your eligibility for this intervention. They've got to start completely over. And so we can go to the next slide, please. Okay. So through information that we were able to gain, or our data team was able to gain, we estimate that roughly 2,500 people per year that are in Rikers need supportive housing. So those are folks that we know have a diagnosed mental illness and are going to come out of Rikers into homelessness or into street homelessness. So I'll say this is actually like a pretty conservative estimate. So we feel safe saying that at least 2,500 people at any given time in Rikers would benefit from supportive housing once they're released. So the graphics on the left of the screen kind of give a little bit of a snapshot of what we're seeing as far as gender identity, behavioral health needs, and a few more stats around the population that is, being held at Rikers now as it relates to, well, some of these general factors, but then also homelessness as well. So you can go to the next slide. We have a lot of information to cover today, so I'm trying to go through these quickly. But if you have any questions or want any additional information, please feel free to reference the report. Or we also have a one-pager that really kind of nicely spells out all of this information as well that we'd be happy to share. Okay, so getting to the impact here. When we look at jail versus supportive housing, it is super clear that it is way more cost effective to invest in putting folks into housing than it is to constantly see folks going through carceral systems. So that population that we were talking about, that like 2,500 folks or so that would benefit from supportive housing on Rikers, they cost on an average $1.4 billion per year to house them in carceral systems and keep them incarcerated. Whereas for that same population, if we were to invest in supportive housing, the cost for a year would be $108 million. So we could get them housing and services to help them stabilize and then maintain that housing for a literal fraction of the cost that it's costing the city to keep these folks incarcerated. So even if we're not, talking about like the morality or the ethical perspective of why it's better to put people into houses and get them the housing and get them the services that they need, we can make the case financially, right? So it would cost the city about $1.2 billion less to invest in housing for this population. So if you need numbers, if you're talking to numbers people, this is a really impactful one to help make the case. All right, next slide, please. Okay, so I am going to turn it back to Camila or Emma to introduce our panelists. And I'm really excited. We have a great group of panelists for you today.
Thanks so much, Lauren. So good morning, everyone. Now we'll be starting our panel for today, and kicking us off, we have Darren Mack, who will be joining us. And Darren Mack is an activist, advocate, and organizer. Darren is a co-director at Freedom Agenda, a member-led organization dedicated to organizing people in communities directly impacted by incarceration to achieve decarceration and system transformation. We also have Kendra Clark this morning on our panel, who is the Vice President of Policy and Strategy of Exodus Transitional Community, a preventative reentry and advocacy nonprofit organization located in East Harlem that serves over 3,400 people in community and 10,000 New Yorkers on Rikers Island each year. Kendra oversees Exodus's policy and advocacy efforts, including supporting the closure of Rikers Island and the transformation of our justice system. Most recently, she is a project manager working to develop supportive and affordable housing for the justice-impacted population. And Kendra holds a master's degree in public policy and administration from John Jay College of Criminal Justice. Next, we have Lisa Lombardi, and she has been the Deputy Executive Director of Urban Pathways. Urban Pathways was founded in 1975 and is a not-for-profit social service and supportive housing organization that serves adults experiencing homelessness in the New York metropolitan area. Prior to Urban Pathways, Lisa was Vice President of Help USA's Central Office. She also has experience as an adjunct professor and field supervisor at Fordham University School of Social Work. Additionally, as a licensed master social worker, she has experience in clinical private practice. And Lisa earned her bachelor's, master's, and postmaster's from Adelphi University School of Social Work. And last but not least, we have Basma Eldwick, who is Director of Social Services at Urban Pathways Scattered Site Program. Ms. Eldwick oversees the DOHMH, Justice Involved Supportive Housing Program, also known as JISH, as well as the Active Users Program. She also oversees a senior reentry program in collaboration with Trinity Church Wall Street. Ms. Eldwick's passion is working with justice-involved individuals, providing holistic services and access to resources. So as you can see, we have a great panel with us, great panelists today. So excited to have you all here. And I am the moderator today. My name is Emma Cappel, she, her, and I am program manager at CSH. To just make sure all of our stuff looks good, I want to include Lisa. Hi, everyone. Good morning. Hi, panelists.
Good morning.
Good
How are
morning.
you all?
Good.
Great.
I know I just gave your all bios, but if you want to introduce yourselves a bit more, share some of your experience and why you are excited and interested in talking with us and sharing with us today. So whoever wants to start first. Looks like Darren's off mute.
Okay. Sorry, Lisa Lombardi. Sorry for camera. Camera's not working on my phone. There's always a technical glitch here. Just to note that I think what makes me proud of what we do at Urban Pathways is really the partnership. It's really about a partnership, and you can't do this without partners and working together. As we all know, there are all barriers. The information you provided, we all realize that those are big issues. We understand moving people into homes and apartments and different programs are a lot cheaper than incarceration. I think we all can agree on that. The question, I think the biggest question is, what do we do to improve it? So I oversee a big portfolio at Urban Pathways between outreach, safe havens, permanent housing, supportive housing. I do, the outreach on the street, understanding chronically homeless. I never understood why you're in jail and we're not considered homeless. I mean, to me, that's a false sense of having a house. So I think that's something we all should be fighting for. So that's just a little bit of, I do a little bit of everything. So thank you for having me, and hopefully we can come to some positive solutions or ideas after this whole panel discussion.
Great. Thank you so much, Lisa.
Oh, well, I can continue since Urban Pathways has the mic. As Emma said, my name is Basma, and I've been working for Urban Pathways for about a year now. But prior to coming to Urban Pathways, I worked for the Center for Court Innovation for about 10 years. And I've always worked with individuals who are having some kind of justice involvement, whether it is an alternative to detention programs or alternative to incarceration programs, and now directly in the housing system for justice involved individuals. And I'm super excited to build community with you all here today and to share thoughts and ideas. So I'm excited to see where this conversation goes. Thanks for having me, Emma.
Thanks for joining.
And I'll jump in next. My name is Kendra Clark. Again, I'm the Vice President of Policy and Strategy with Exodus Transitional Community. And I think for me, most important, to create housing for folks is because I've experienced homelessness myself. So as a young person, I was in and out of incarceration and homelessness for over a decade. And just cycling in and out of it and having nothing but the clothes on your back when you leave incarceration and not knowing where you're gonna get your next meal or where you're gonna sleep at that night and everything that goes into that, especially when you're a young person, a youth. It's really sad, and I see it every day. I work with young people every day who are experiencing homelessness, and it's this vicious cycle that unfortunately, I've witnessed and experienced for generations. So really excited to speak with you all today and see how we can create housing together. And I'll pass it over to Darren.
Yes, thank you, Kendra. So again, my name is Darren Mack. I'm co-director at Freedom Agenda And as was mentioned, we work with directly impacted people impacted by the carceral system. And we have a broad definition for directly impacted people. Not only do we consider a person who experienced incarceration as directly impacted, but we also consider the family members of those, who experienced incarceration as directly impacted. Because if you incarcerate a mother, the children are impacted by her incarceration. If you incarcerate a spouse who may be the main breadwinner in the home, that spouse is also impacted by, that incarceration. So, in New York City, there's like approximately like 750,000 people who have a criminal conviction. And that's about 11% of the adult population. And they have families. They have families. So this issue around housing not only impacts, people who experience incarceration, but it also impacts families, communities. And I believe, as Lisa mentioned, in coalition, and we could address this housing homelessness crisis that we have in our city.
Yeah, awesome. Thanks so much, everyone. So looking at the numbers, we saw and we know that Black and Brown communities are overrepresented in both carceral and homeless systems. How, in your experience and your knowledge, how has systemic racism and inequality impacted this disparity?
Yeah, I could speak a little to that. So I'm also a student of history. Like I love, U.S. history. And basically, from what I've learned, and I'm sure like our audience knows, that systemic racism is baked into the fabric of housing in the U.S. We can go not just far back from legal segregation under Jim Crow, to redlining of Black people. That's why the civil rights movement and civil rights laws were passed, to end that discrimination. But unfortunately, we still have people who want to preserve racial division in housing. That's why, it keeps rising its head in various ways. Now, not too long ago, there was a case in which an appraisal company undervalued the home of a Black family based on their race. Newsday, I think in 2019, Newsday had did a 3-year-long investigation in Long Island, having secret testers, testers applying for homes in Long Island, and they uncovered widespread evidence of discrimination. So for too long, in this era of the new Jim Crow, as Michelle Alexander brilliantly coined the term in her book, The New Jim Crow, we see this legal discrimination occurring with Black and Latinx New Yorkers. And 80% of New York City residents with a conviction are Black and Latinx. And so we can't end this racial discrimination in housing if we don't end, conviction record discrimination, because denying people housing based on conviction records is often a proxy for denying people based on race. So this is something that I think we can address, and it's going to have a positive impact on not just people like myself who experienced incarceration, have a conviction, but on families and everyday New Yorkers. And we have to move forward to, to address this issue to make our city a more inclusive New York.
Absolutely. How do you all believe that access to safe and stable housing can make a difference with this, going off of what Darren's saying here?
I believe, and studies have also shown, that having access to stable housing can tremendously affect recidivism. So for example, a lot of times when individuals are homeless, they're more likely to have interactions with the justice system, whether it is panhandling or loitering or trespassing or a plethora of other charges that they catch while they're on the street, or even couch surfing and trying to make ends meet, because being homeless can look very different, right? You can be in a shelter and you're homeless. You can be street homeless. You can be sleeping on the train. You can be couch surfing. So the individuals are always trying to figure out different ways to make ends meet. Thus, they end up having more interactions with the justice system. But when you provide someone with stable housing, you automatically lift a huge weight off their shoulder. Now make that supportive housing, and with supportive housing comes supportive services, and therefore you end up addressing all of the different issues that the individual could be struggling with. So you can help connect them with care. You can help connect them with maybe psychiatric evaluations or medical, even employment, benefits like SSI and Medicaid, a bunch of different services. Therefore, you do end up, like Lisa mentioned, saving the city a lot of money in incarceration costs, and you end up making a huge impact in people's lives.
And I can add a little bit to that. I just want to add, when I hear her speaking about that, I hear her talking about community safety, right? And that's kind of a phrase that we're trying to move to, like, what is going to make our communities safe? Does it make our communities safe by allowing people to keep recycling in and out of incarceration and not providing them with the support that they need, so then they're able to be out there harming communities and committing crimes, right? Like, what does community safety really mean? To me, it means investing in people and providing the resources that they need, so then they're not back out on the streets and having to commit crimes, right? So I really want us to think today, as we're speaking about community safety as a phrase.
Great, thank you for that. I would like to keep that train moving on the community safety piece and public safety, because oftentimes, depending on where maybe you are in the country, city leaders, politicians, residents talk about community safety, public safety, and they think more police and more police presence. And we're kind of seeing that right now in New York City too, in the subway systems and at parks, even, that police is to make this community safer, and that's the solution. But is that the solution? What is the, like, how can we expand that narrative? How can we dig into that and maybe even change that narrative? Because what does public safety in a community look like beyond policing, and maybe instead of policing?
Yeah, I could speak to a little to that question. So there's a statement, I don't know exactly like who coined it, but and I might be butchering it a little, but it's something like, the safest communities are the most resource communities, not the most police communities. If you go to look at the most resource communities in New York City, those are like the safest communities anywhere across the country. The most resource communities are the safest communities. So when you have concentrations of poverty and working poor, and I say working poor because you have a population of people who working, 9 to 5, but they're like one check away from being homeless. And they're in particular communities. And when you have that, we obviously are going to have negative outcomes. So instead of reacting to the symptoms, we should be like analyzing the root to the symptoms, like poverty and housing, and addressing that. There was a study that was done by incarcerated men in the late 60s, early 90s, known as the 7 Neighborhood Study. And they found that over 70%, it might have been over 75%, of New York State's prison population came from 7 New York City neighborhoods. The South Bronx, Harlem at the time, Lower East Side, Bronzeville, Brooklyn, East New York, Bedford-Stuyvesant at the time, and South Jamaica, Queens. Now, if you're a New Yorker and you know these communities, you could understand why, these communities basically make up a majority of the population incarcerated in New York State prison system. And it applies today. Most of the people on Rikers Island or New York City jail system, come from these communities. Those are the communities that's been historically under-resourced. So and the one thing, unfortunately, our city has like invested in is policing. You know, policing budget it has like risen through the roof. It's like a blank check. So to a hammer, everything looks like the nail, and policing is responding to people with mental health issues. Policing is responding to people who have a substance use issue. Police is responding to, you know, unhoused people in the streets. We need to be investing in those things that tackle the roots of the issue, like poverty and unhoused and housing, and not just utilizing this hammer, you know, as a public safety issue, because true public safety is when communities are resourced with the things like mental health, like housing, etc. So that's just, you know, and I'll stop right there, but that's just like how I think we need to be looking at public safety from a different lens, you know, because this is something that we can solve. We in New York City, we in the wealthiest city perhaps in the world. It's something that we can solve, but we need system stakeholders, you know, elected officials to basically make the investments to, you know, address those issues, the roots of those issues, and not just the symptoms.
And, you know, I just want to add, we're also, you know, inadvertently setting our police force up to fail because we're tasking them with a job that they're not equipped to do, right? The police are not mental health workers. That's not their job description, nor is it ever going to be their job description. So why do we keep investing in police to handle the mental health crisis? It makes no sense. We wouldn't accept that in any other form or fashion. And so we really need to be thinking clearly about that and invest in the resources that are needed, in the staffing and the culture that's needed to really transform the system, and not continuing to set even our police officers up to fail.
And if I may add, Lisa Lombardi, is that the whole triage point of view of community policing and mental health and nurses and doctors is really trying to go back to somewhere along the line where you really have a group of people that handle these situations. Because I think, Darren, you hit it on the head about everything, in that we focus on communities that's easier to blame rather than focusing on the community to make it easier to resolve and make the community part of the resolution. We treat them like they don't belong. And I think they act like they don't belong because we treat them that way, and all they want to be included, and equity and money, and same thing that everybody else wants. And you made a really good point that the resources are in certain communities, but it's really not working either, because you're talking about extreme poverty and extreme wealth. And until politicians and everybody sit down and really talk about that, I don't believe that changes. However, with what we have, we do a really, really good job considering out there, but we need to work together. You need to have the nurse, the case manager, the community police, and anyone else in the community. I invite any politician to come out and handle some of the cases that we deal with and really see it for themselves rather than it being a vignette.
Thank you for that. And I'm gonna have two parts of a question here, so feel free to answer whichever. So when we want to, talking about putting more resources in the communities and more accessibility to these resources as well, why is it important to prioritize housing for the justice impacted population, for those with a carceral background? And on the flip side, how could welcoming this population into safe, affordable housing actually enhance the community? And so why are we prioritizing this population? And then why, how can the community members welcome them back?
I think this goes back to what Kendra was saying in the beginning about the idea of community safety and public safety. And I feel like we kind of already answered this earlier, in that by providing the individuals who are committing these crimes or offenses a safer community and access to resources and stable supportive housing, you are inextricably, it's bound to lowering crime rates, and thus creating a safer community for everybody. And I think the best way to welcome them into our community is not to isolate them. And us working at Scatter Site, we're a really good example of that. So For those who don't know, scatter site housing programs are pretty much apartments that are within the community in normal buildings, normal houses, that are being rented out through us to individuals that are in our programs. And that's a really good way to provide the individuals direct access to the community rather than ostracizing them and placing them into specific buildings where, okay, everyone in this building, beware, these are the people that have X, Y, and Z. They have the mental health, they have the criminal justice involvement, they have this, they have that. And it kind of just puts them into like a box. That's how true it is. My dog is had an input. So yeah, so scatter site is a really good example of allowing the individuals entry into the community with the support of supportive housing programs and access to resources.
And I think to add, why we need to focus on this population is just at the height of COVID, we had a daily population of nearly 3,800. Right now, we are halfway to closing Rikers. We have less than 5 years left, right? The daily population keeps rising, and it's because investments in alternatives and supportive housing are not there. 16 people have died already this year on Rikers Island. Rikers Island is a place to hold people who commit misdemeanors. Like we're not talking about, we need to actually think about what that jail population is and how many folks have died needlessly, just without any cause at all. So I think really prioritizing this population will allow us to decarcerate the safest way, the fastest way to really reach our goal and be able to completely transform our system, because Rikers Island has been a stain on this city for decades and it needs to be closed. And I'm sure Darren has more to add on that.
Yeah, I just add, because our audience might not know, about Rikers Island. It's a pre-trial detention complex, with 10 jails on there. Pre-trial, meaning almost 90% of the people detained on Rikers Island haven't had their day in court yet. They haven't been convicted of anything. They remain detained because they can't afford their bail, the majority of them. So therefore, they have to go to court, while being detained, incarcerated. And it, the comptroller, the past and the current comptroller, basically, shared information about how much it costs to detain one person on Rikers Island a year, almost $500,000 that taxpayers are paying to detain one person on Rikers Island for a year. $500,000. So, the department basically, like, we could be doing better. We spend the most money and get the worst results. As Kendra mentioned, 16 people lost their lives. Hundreds and thousands are suffering because of inhumane conditions. We could do better than that. And you have a coalition of organizations working, in a coalition and presenting solutions. As Kendra mentioned, community investments. We need community investment. We need to be doing something different, because if we keep doing the same thing, expecting different results, that's the definition of insanity. And we could look and there's other models. There's models to address this issue that's proven to be successful to all New Yorkers' benefit, that enhances and moves forward public safety. So that's the only thing I'll add to that.
And I just have one final thing to add. I know we're running out of time. The Renewable Rikers Act. Once we close Rikers Island, we are going to use the 400 plus acres on Rikers to create solar panels on the island that will help solar power the entire city, to close down the peaker plants that have been placed using environmental racism, and allow for housing or mental health treatment or whatever programs are needed in those communities. And then it will also allow us to redistribute the water waste systems, right? So we're talking about, outside of even closing Rikers, the health benefits that the entire city is going to experience from the Renewable Rikers Act, which is already passed and is already going to be happening after Rikers is completely closed down.
Yeah, thank you for all that. That was great. Now switching gears and focusing on the barriers unique to this population and how policies and access to housing can impact and perpetuate cycles of crisis and reincarceration. What unique barriers do people with carceral history face in their house for searching? And this could be psychological barriers, technical, social, financial. And I'll pause there because there's more to this.
So as we mentioned earlier, I believe Lauren had gone over this, but first thing people face is they lose their definition of being chronically homeless. So again, someone can be homeless for the past 20 years, but can go to jail for whatever reason for 3-4 months, and now all of a sudden they don't qualify as being homeless again. And once they're released from jail, they lose out on being able to apply to a bunch of programs that require you to be chronically homeless. So that's one. Also, obviously having the taboo attached to you as being someone with a criminal background that comes up on job searches. Now, people who rent apartments now will do searches that are insanely intense. Not only credit checks, but letters from previous landlords, sometimes even employers, and those individuals might not be able to provide those things, or might not have a great credit check or credit report, and therefore don't qualify for a lot of regular housing. And of course, social skills, and depending on the amount of time that you've served, you can have a lot of trauma and a lot of psychological impact on how you conduct yourself socially. A lot of times people say individuals who have not been fully involved in the community might need help to even be able to transition to community housing. They might need to be, taught basic social skills, how to manage your emotions, how to conduct yourself, how to even take care of an apartment, or to have to clean or do basic, activities of daily living, as we would say. So those are definitely some unique challenges that they face.
And I think, what I've seen a lot of is folks come home and they don't have any of their vital documents. And then getting their vital documents is a nightmare, because sometimes they're born in another country, born in another state. They don't have enough points to be able to get the ID. How do you do that if you don't have the documentation to get those points? And it's like a constant battle. And you need all of that information in order to even apply. We call them 2010E applications, or 2010F, however you want to say it. But those are the applications you have to complete in order to be approved for a supportive housing placement. And that process, I just want to say, throughout the last couple of years that I've been doing it, you're sitting with folks, and I'll never forget, I sat down with this gentleman who was probably in his late 60s, had been experiencing homelessness most of his life, but of course didn't qualify for supportive housing based on the HUD definition, because he had been in and out of psychiatric hospitals and jails. And when we're going through, and you have to give your last 3 to 4 years history of housing, he was like, "Miss, how am I supposed to remember?" And I said, "Sir, I understand." I said, because if you were to ask me all of the places I lived when I was homeless for those 4 years, really hardcore as a young person, it was in and out of random hotels. It was in and out of people's couches. It was on street corners. It was you're not going to remember all of those specific places. And then often the 2010E applications don't allow you to qualify for that anyway, unless it's been documented or verified by an outreach team. So the process of it takes a couple hours. You're working with someone who usually has serious mental health concerns, right? And just having them have to sit there and answer these questions that they're not really often able to even answer fully, especially when it comes to housing history, is very discouraging. It's just not a nice process all around. And if we were try to figure out a way to help folks be able to better do this on their own, we don't teach digital literacy inside, right? So when you're incarcerated, you don't have access to digital literacy at all. So I have a lot of folks that come home, if they've done 20 years or however long, they don't know how to attach something to an application to apply for something. So that's like your first step. And then with the vital documents, in addition, that prevents people from getting employment. I see it all the time because they're not I-9 compliant. And it's months before we can get them I-9 compliant because the process is so slow. So again, those are other barriers. Like we have folks that want to work that aren't able to work yet because we're still trying to get their vital documents so they can legally work. And all of those processes could be automated while you're incarcerated. So we have the solutions to be able to fix them. We just as a society are choosing not to invest in those solutions, not pass these laws and bills that requires and mandates the Department of Corrections to provide this documentation. So that way it's easier. So the level of barriers is very massive. And I'll turn it back over to Dan. Oh,
Kendra, that's a really good point about the documentation prior. I mean, you're serving time. Why not set up a system that we can track it and make it a lot easier? And also just having them, I never understood the process of just letting them leave jail without a plan. I mean, you get a letter, they need placement, they call us, they need placement, and you feel bad because you don't really have options other than one or two places initially. And then you have to start the process. I also think the barrier also is many of our folks have been incarcerated for years or months or whatever, in and out, it doesn't matter. But then they come out and it's like a freedom of just getting themselves to feel free again. And free could mean a lot to different people, but I can't imagine you're putting them in an apartment or a facility and it's just here, it's the rules all over again. And I think sometimes we forget what it's like to lose your freedom sometimes. And if any of us have, some of us have, some of us haven't. It's very difficult. And I think what we need to do better is just like you said, plan better, have certain places ready for that, do discharge planning so much better than what we do. And then the poor person is on the street looking for a place, which just makes no sense to me. I think also barriers are finding proper housing, finding landlords and brokers that want to do business with you. I know it's difficult and we all know they're not supposed to discriminate, but we all know it's done, whether it's done outwardly, inwardly, whatever. It's done and we all understand that. And not that we like it, but we try to work around it. What I try to do, I try to build my relationship with the brokers, with the landlords, and also it's a partnership and commit to making sure we take care of our property and we take care of, we're neighbors, we're good neighbors. And we really try very hard to get that across so that people will rent to us and say, even though it's challenging, we know that you're going to respond when there's a concern, and we do. You can't respond to everything and everything is not always true. So I always say, we'll look into it, but it might not necessarily be our client. It could be somebody totally different. Anyway, I think all those things are included. I also think staffing is important and making the caseloads less, because I think when you're dealing with a population that really in the beginning, it takes time, you need to have 1 to 8, not 1 to 12 or 15. I think 1 to 8 is better. And also having, like I said, a triage of group of people that go out, whether it be medical, nursing, psychiatrist, case manager, and just really try to work with the individual to kind of say, look, we're here. What do you need? What would best suit you right now? And that takes time. It takes a lot of time and a lot of energy. And then unfortunately, I believe drugs have taken over a lot more than I would like in this area. Yes, there is mental health, but the drug situation I find in this program has really been the most challenging in trying to help our clients and accept services, especially substance abuse services, which we all know is voluntarily, but that's a challenge. That is a big challenge. So hopefully we can keep working on different areas.
So some of you all have touched on the discrimination around community members with carceral history and the housing system. But I want to speak a bit more to that and kind of be more explicit with what we mean by stigma and discrimination and what they are facing. I know we shared some stories at the beginning that Darren mentioned of Long Island, but thinking of what the collateral consequences of a criminal legal record mean, what qualification and eligibility criteria are now affected, and at the end, what have other communities put in place to be more inclusive and more understanding of this background?
So I guess I'll start and then I'll pass it over. You know, I always share my story. I came home from prison in 2011 and couch surfed on and off for 5 years before I could afford my own studio. Because in addition to all the other barriers, just rent in New York City, having to make 40 and 50 times your rent is almost impossible when you're first come home and you have any kind of entry level position. And then also building credit. I had no previous, landlords for years, so I didn't have any credit. I didn't have any references, so it was just impossible. So it took 5 years, and I worked full time and went to school full time the entire 5 years. I just want to caveat that. And finally got my own studio. So 5 years after I'm in my studio, I'm an executive now at Exodus, and I want to move into a 1-bedroom. Like, finally can afford it. I want it. Didn't think I was going to have to experience the same discrimination, because now I'm an executive. I have a master's degree, still experience discrimination, right? My criminal record just kept getting in the way. And it was just a constant. It was very defeating, because then it was like, okay, there's nothing I can do clearly that I'm not going to experience this discrimination, because, it doesn't matter how many letters you get after your name, how much money you make, it's still going to be there, obviously. And so I always tell that story because it happens to so many of us. And, luckily I got really lucky, in the landlord that I lived in, the building that I had a studio in, there was a 1-bedroom that opened up, and that's how I ended up getting my 1-bedroom. I moved into the same building that I was already in, and the landlord knew that I had been there 5 years, had never had a late rent payment, had never had a noise complaint. So I talked now to a lot of landlords about how they missed out on me as a tenant. And now I'm 8 years into my, apartments, between both apartments, and I've still never made a late rent payment or had a noise complaint, right? So I'm a very good tenant, but all these other landlords got to miss out on me. And I just want to talk about the background checks just for a second, because criminal background checks that landlords use are unregulated. I mean, there is no regulatory criminal background source that you can go through unless you're directly going through DCJS, the Division of Criminal Justice Services. And that's not the outlets that I've ever seen a landlord use. So, there was a report that was done, and just between the years 2015 and 2019, it's actually in the New York Times. They found that a background check company produced 11,000 inaccurate renter background reports between the years 2014, 2019. And that was for folks who didn't have a criminal background, but these background checks said they did, right? So you're also like bypassing tenants that don't even have criminal background checks because of the background check services that you all are using. We really talk about how would my criminal background when I was homeless and a young person and committing crime, how does that impact me today as a tenant? It doesn't. And I've proven that, because for the last 8 years, I've been paying rent, have had no issues, no noise complaints, right? So what really I think we should look at is, that kind of history. What is their financial history? Are they working? Are they in programs? Are they trying to do what's right? Are they trying to get to that level? Because if they're trying, then again, we're talking about community safety, and this is going to increase, community safety by providing people with stable housing. So I'll leave it there and turn it over. I know we got lots of other folks with good stuff.
Yeah, not sure if other folks want to chime in, but Kendra, you kind of basically summed it up. Like, there's a coalition of organizations, in New York that came together. It was called to work on what's called the Fair Chance for Housing Act. So this the Fair Chance for Housing Act. Basically, it would basically end housing discrimination on the basis of arrest or conviction. And this is just like, one of the things. There's definitely renters, people, landlords who don't necessarily do background check, because I've rented before and that wasn't a question about it. And they was like, and when I was moving out, they was like, why are you leaving one of our best tenants? I was like, I was renting because it was basically, it was a room in an apartment for like 2 other people. And I wanted to like, you know, move on to the next level with some independency while having my own place. But yeah, this is a simple issue, a simple solution to, you know, to end this housing discrimination, to be more inclusive, you know, in New York City, in the housing market. And I think we way overdue, you know, we way overdue for this. You know, this is New York City. We're supposed to be the most progressive city, you know, in the country, but in far too many ways, you know, for those like myself who been impacted by the criminal legal system, you know, at the age of 17, you know, to continue to live the rest of my life, to be legally discriminated against. After all of that done, I've got a master's degree, you know, at Hunter College. I'm a co-founder, co-director of a non-for-profit. I've spoken on panels from Harvard University to Columbia University, and to still be discriminated against. Like, where's the second chance at? You know, where's the second chance at? You know, if we believe in second chances. So, you know, Fair Chance for Housing Act would, you know, prohibit that housing discrimination. And I think we you know, moving forward with that, it'll basically make our city more inclusive, and it impacts families as well. It's not just the person who experienced incarceration. You know, you have people who have conviction, who have families, their mothers, their fathers, you know, their children, you know, so that right there in a nutshell, you know, we need to get that legislation passed, and we have full support city council, and we need New Yorkers and people in the housing market to come and support, you know, this legislation, so, you know, we can actually be a more inclusive New York.
And before folks get, you know, confused, Fair Chance for Housing, it doesn't discriminate against anybody based on their charge, right? And when we talk about people, I know that's one caveat that developers and landlords are always, you know, nervous about. What if it's somebody who committed murder? People who commit murder and get released are the least likely to recidivate out of anyone. They've spent decades inside prison, and they're so loyal to coming home and doing what's right because they don't want to go back. So it's actually the population that recidivates the absolute least. It's like less than 1% recidivate. And also, when you're talking about people who may be on the sex offense registry, that is public information. The Fair Chance for Housing Act does not prevent you from looking up in a public, you know, public portal whether someone's on the sex offense registry. So those are just two, you know, immediate things that often landlords are worried about. And so I just wanted to make sure that we knew the facts on that before we went forward.
I just want to add one last thing also. I think it's important to keep in mind that individuals experience co-occurring discriminations and stigma. So you can be a Black, African-American, Hispanic, Latino, Latinx individual. You can be young, you can be with a disability, you can have a mental health diagnosis, you can have a criminal background and a serious history of homelessness, and add all of that together, you pretty much have a recipe of impossibilities, right? So it's super important to have in place programs like ours and different kinds of supportive housing programs, because we help break down those stigmas and we help connect people to services and to opportunities that they otherwise wouldn't have a connection to. Like I believe Kendra mentioned this as well, like having to meet 40 times of your rent and income, you know, you're talking about a state that once you hit 11,000 of income, you're no longer eligible for like Medicaid, you know, $11,000, you know. So you can, I can think of a person, I want to save him for later as a success story, but he was finally able to get a job. And once he was able to get a job, he was like, oh my God, I don't have Medicaid anymore. Oh my God, I don't have food stamps anymore. Should I just quit my job? Because it just made so much more sense to be unemployed and have those benefits rather to be employed and barely making ends meet, and now losing all those benefits and have to pay for health insurance and now have to pay fully for everything out of your pocket and not being able to do that. So there are so many barriers in place. We want housing to be the least of their concern because that's at least something we can control.
Absolutely. And I just have to add to that myself, actually. New York City 1515 is the city funding resource for supportive housing. And as Lauren and also Basma mentioned, they follow the HUD chronicity requirement, the US HUD and urban development requirement, but that's a federal requirement. And we are city funded. This is a city funded program. So it's not necessarily that HUD is giving the city this money and that's why they're following this regulation. They needed a regulation to go by, and that's the one that we're using, but that could be changed. So we need to keep speaking up on that as well.
And that's been long-standing, long-standing, and I don't get
Yeah.
it because you're right, it's federal, but they use that absolute definition and kept it. So I never understood that either, to be honest.
Yeah, no, it's great. And now switching gears and wanting to see what programs, as Bosman was mentioning there at the end, what programs, what incentives are available in New York City for developers, real estate management companies, our audience here. What can we share with them in regards to tips and incentives?
Well, I think we started maybe several years ago where there was some more incentives, I think, when before the pandemic, in terms of opening up new programs. I think they were given a little extra funding for every apartment. So that does help. I think also what's different right now, and it's just different, it's that apartments have gone up again. So pricing has gone up. So the challenge is making sure that we find the right apartment and it's maintained so that we can also help maintain it and have a reasonable rent. I think some of our programs are on budgets where they don't always extend the money. So I think that's something we always have to work on. How do you get more funding as the apartment of rents go up? So I think a combination. The other way too is if a developer or broker gives us, let's say, 4 or 5 apartments and we definitely commit to the payment, sometimes that helps in lowering the price. So I think different things like that. Again, working together, making sure that we respond to any client issues, whether it be rent, whether it be anything else, but they're going to get their rent. I think that's the selling point. The client pays us, we pay the rent. And I always think that helps tremendously. And again, like I said earlier, responding and following up is so, so important with the landlord and with the client. So when a landlord calls, we follow up immediately. We try to figure out what's going on, and then we try to resolve it. And I have some really great landlords that really work with us and really, to be very honest, are very impressed with some of the clients and really want to help. So those are the factors I think do help together.
So if you want some specific examples, we've spoken about the JISH program, which is for justice involved supportive housing. And that's we pretty much work in collaboration with the DOH and MH. And then we have privately funded programs like the Senior Reentry Program that's funded by Trinity Church Wall Street, and that one is specifically for individuals over 50 and over who have I guess more of a serious history of incarceration. And when you have programs like that, the staff themselves who work with those clients have to have really good knowledge about the criminal justice system, whether it is lived experiences or just, just education, etc. And we try our best to work with the clients to help them address all those barriers that they face. So sometimes that could mean showing someone how to use their phone. It can mean showing someone how to use a computer, like Kendra mentioned, and not being able to access technology because they were in and out for so long, or street homeless for so long, or maybe served too long of a period of time and therefore aren't up to date. We've had people who we had to teach how to use public transportation and how to navigate that. But also very basic things. Sometimes people have fear of going to public buildings or government buildings like HRA, for example, if they have to go to the office. We've had our staff escort people to appointments or just be on the phone with them when they have like a phone interview and just to kind of give support. So our goal is to foster independence. And that's why we tell landlords, like, you want to work with us because our clients have extra support systems that normal tenants do not have. They have a plethora of people trying to work with them and support them and make sure that their needs are met. You can communicate with us directly. Sometimes you don't even have to communicate with the client. So yeah, those are just two programs that I wanted to highlight that focus primarily with justice involved individuals.
And you said, you and Lisa said that Urban Pathways is the leaseholder.
That's
Right.
right. That's right.
Yes, the client, well, we hope the client pays us. That's our challenges. During the pandemic, unfortunately, the message was, you're not going to get evicted, no worries. And I think it was taken to another level, which we're trying to recoup, all of us. We pay the landlord, and that's the selling point. The check comes from us. So it's guaranteed rent. It really is. At the same time, it's not always easy, but like I said, we constantly work with the landlords and constantly make sure our properties, and we have a maintenance team that goes around as well, and really helps and does things that probably are not our responsibility, but that's part of our partnership, and that's part of working with landlords to show that we need more apartments, and there are other programs that we have. So we have about 150 apartments, if not more, in our portfolio, totally, and over 300 clients.
And Basma, you mentioned the JISH program, the Justice Involved Supportive Housing Program. What have you seen as the benefits and challenges for that program? And yeah, I'll stop there.
Yeah, I had dropped the link for those who are interested in just getting a bit more information about how the program started and who's involved. But I would definitely say that, and Lisa could speak to this way more than I can, but I would say we have a lot of success stories. We have clients who have started working with us and continued getting arrested, continued getting locked up while working with us, but not even as often as they used to before starting working with us, and then slowly but surely ended up now fully employed, going back to school, and having rekindling relationships with family members, children, etc. And those stories we're super proud of, and those clients are definitely some people that we hold on a pedestal. But like Lisa mentioned, working with individuals who are fresh out of incarceration or have a large history of incarceration could sometimes be super challenging, especially in a scattered site setting where they are automatically, hey, you just served 20 years, hey, here's the community, as opposed to being in a more support, more, I guess, in intensive care kind of housing setting, because you're not there living with them 24/7, right? You meet with them maybe once every other week, you call to check in on them, but I can't tell you how many times our clients lose their phones, for example, and sometimes that makes it really difficult to stay in contact with them, because they're not used to having a phone, so it's not something they're checking for, and they lose it frequently. So I hate to say this, but sometimes I wish that the discharge planning for individuals while they're still in incarceration involved a lot more of training into what's waiting for them on the other side, right? That would make our job a lot easier, and that would also make their transition a lot easier. And they wouldn't face a lot of the obstacles that they face once they're out. So I definitely wanted to put that out there as well. And Lisa, please add.
Right. What I would add to that is that if I had to do it all over again a little bit, I would do more of a, I think many of so we don't interview the clients, which is fine, but sometimes that interview helps get a better sense of where to place the client and who to place them with. Sometimes it can be helpful, but also a more of a residential setting initially, and then move them to a community. Because I think sometimes, as much as I understand, I was one of those in the beginning, way back, I've been doing this 40 years straight, that housing first was not the model that we use. But then as I learned, I realized that housing first is a really good model, but it has its challenges for some clients who really don't respond well. And sometimes they do better with a more supportive environment, with everything on site initially, and then gradually moving them. Because sometimes the other way around, some folks are really not ready and they have a hard time. I mean, because one of the things too, when you're using substances, or if you're told not to go into communities, that might trigger that. And unfortunately, many of our communities have that. So it has its moments. But if you're in a more maybe residential setting with staff on site, sometimes initially could be more helpful in getting that person services and then moving on to the best community for that person. I know that sometimes is unrealistic, but it really can be helpful. So I think those are some of the things we talk about. But again, we have a lot of people that have really succeeded in taking time. The two clients that we have both got jobs. One got relocated to another city and moved out of state, went down to DC and is doing amazing. And initially it was difficult, but a lot of people do really well once they become more settled, they become more content with who they are and what they're doing, and see that working has a lot of positives socially, economically, confidence. So I think that's what we're striving for. So although I do think there are a lot of ways that we can, go slow, it does take time for clients to kind of turn things around. But we have a lot of clients also that start to accept long-term treatment. When you see that, you feel really good about what they're doing. So it does take time.
Yeah, I just wanted to say a little bit about like my experience. So like I came home 2012, and like what Basma like mentioned about like preparing people while in the inside, so they could have a soft, safe landing when they return back to our communities. I'm an alumni of this program called the Bar Prison Initiative, and they had a re-entry specialist to like help people navigate. Like, okay, you come going home in 6 months. Where are you gonna stay? How about work? Putting all this charge plan together. So I had secured housing through a program called the Redemption Center. It was developed by someone who formerly incarcerated, the name of Mark Graham, and he understood that it was a need for housing for people because, unfortunately, our shelter system in New York City is not a good place. That's probably why we see so many people who would rather live on the streets than be in our shelter system. And I've heard like it's not safe for people, and I've heard like really like horrible stories about it. So basically, I had secured housing before my release, and at that time we didn't have this was something new. This is like justice involved supportive housing is new. We didn't really realize that some folks needed these wraparound services, right? And it wasn't so. I had got my wraparound services like like a peer mentor to navigate me through the system, to get ID, to go to HRA from BPI. The Redemption Center didn't have it at that time. But so that's why justice involved supportive housing is so important, because when you have the resources to get the staff, to hire people, especially and people who experience this situation, to help others navigate through the system, we could have more successful outcomes. And we need to invest in that. Justice involved supportive housing just is critical to public safety.
Yeah, just one thing to add on to that, as Darren was talking about, the shelters are not good for justice impacted people specifically because they have so many co-occurring issues. And especially when we talk about mental health and substance use, when you look at the shelter system in New York City, it is very, very few that actually have supportive services on site, right? So again, it's also kind of setting the shelter system up to fail, just like we set every other system up to fail. I think they're broken for a reason, to keep people in these cycles. But if when we really talk about this population, this is a population that's very specific that the shelter does not work for, right? So I just want to make that
clear. Yeah, thank you. Those are all really great answers. I really appreciate that. And with that, I want to leave us with our final question. What is one takeaway you hope the audience leaves with today? And you can pair this because I know we skipped the tips for developers and success stories. So if you want to pair your takeaway with that, feel free to.
Well, I think the takeaway is we have more work to do. I think we have to do a better job on partnering. Just this group alone, I'm impressed. I've never met anybody, Darren or Kendra, so I appreciate it. You're amazing. I think maybe that's something we should do more often, and having a discussion together about different ways to maybe improve some of our areas of concern. The whole thing with Rikers, how do we manage that better? I think that's a big issue. Or how do we talk to somebody there who can maybe not just say goodbye, you're gone, you served, great, now go find a placement. Maybe we need to really start there, because I think it's really a disservice to our clients, and how we do it. So maybe that's certain ways that maybe we can talk together and just see if anybody has any other ideas. But I think it's a really good start. I think we are servicing our clients, which is very clear here. Always, how can we do it better? I do think funding has an issue that maybe we need to look at getting more funding in different ways that could be helpful. And that's pretty much all I can see right now.
And I'll go next because I'll add on to something Lisa said. You know, the partnering is so key. We're just getting ready to submit our first eSHI. I'm still technically looking for my first site, but I've got a lot of things kind of going on simultaneously. But, you know, for months previous to this experience, I was trying to kind of do this outside of going to the experts. And I learned the hard way. You go to the experts, right? Like, don't try to do this on your own, because there are developers out there that don't have the best intentions, right? And then there are some that have really great intentions, and those are the ones that you want to be connected to. So I leaned on Corporation for Supportive Housing, the Supportive Housing Network of New York, Fortune Society. I mean, all the experts, right? And we've hired Rockabelle Consulting, which is an amazing, phenomenal developer and consulting firm. So I want to give them a shout out. And it's been like night and day from when I was like literally pulling my hair out and kind of almost charging across the table at one of these developers, because it was to that level of like insanity that I was losing my mind, to now being in a much better space and being able to, I feel strong about us being able to do this, because it's scary for nonprofits, right? When this is your first time taking on, and you're talking about hundreds of millions of dollars and all these new finance streams that you're not quite sure of yet. So really, you know, what Lisa said, partnering and reaching out to the experts and getting advice and feedback, I think is super key. And then, you know, my final thought is we could save $1.2 billion every year by just providing people with supportive housing over incarceration. Like, we've got to start taking control of the money and stop letting the money cycle in and out the way that it has been for decades. Like, we've got to stand up and say, hey, can we be smart about money? If we're not going to care about morals, let's at least be smart financially and really try to get the city into a different kind of space that way. Because 1.2 billion every year just on that one small fraction of what we could do with Rikers, that's a lot of savings and a lot of good that we can do. And then that reduces recidivism. We could actually see our communities the way that we want them within the next decade. It's been done in other states and other countries. There's no excuse for us not to do it here.
I would also add, the takeaway is don't be scared to work with our clients. Like, just a message for developers and real estate folks out there. Like, don't be scared to work with our clients. A lot of times they have a really good support system. If not family, friends, it's programs that they work with. We know a lot of our clients struggle with even finding an apartment with a Section 8 voucher. Like, landlords see that, like, and they're like, oh no, like, we don't want to, you know, give you an apartment with a Section 8 voucher. So don't shy away from working with those folks. Like, don't be just another obstacle in the road and another barrier in the road. You can really be the major difference of whether someone ends up back on the street and recidivizing again, and, you know, making your neighborhood unsafe, or being the person who gives them the extra oomph or that extra push that they need to move forward with their lives in a positive and healthy way.
One takeaway is that, I think that, people who, impacted by the criminal legal system in New York City is an untapped market. It's an untapped market. And I'm thinking about like ways to tap into that market, so I think, coming together with landlords and renters, coming together, having conversations of how we can, address these issues and tap into that market. I believe we can do it, but it's all about communication and coalition building. So remember, that it's an untapped market out there that could benefit all New Yorkers.
Yeah, that's great. Lisa, did you go? If you would like to, she did.
No, I went first. I mean, I
Okay.
think, yeah, I
Awesome.
just
Yes.
think that I'd like the group here to maybe we can have a
Yeah.
another meeting just to chit chat, because I do think you do need help. You need to talk to the people who've been around. I think there's a lot of people out there who really want to help some of the developers a lot. They're just not, some of them are not sure how to go about it. It does take time, it takes a lot of time and energy, but also visiting our properties sometimes helps people see what we've done, and your own properties, to see what you do, what works, what doesn't work, and just getting people involved in your organization.
Yep. And then for learning opportunities developers, this training series each month will be going over lessons and learnings for developing for these folks, so this population. And this goes to regulations, understanding requirements in New York City, how to fund these kind of projects. So be on the lookout. And Jomo McLean, I saw your question. We will, if you are able to hold off on that for a little bit longer, we'll have a Q&A session shortly. And some folks are leaving some emails. The panelists are leaving some emails. Thank you so much. And just want to give a huge, big thank you to our panelists, Darren, Kendra, Lisa, Basma. Thank you so much for sharing your experience, knowledge, expertise, and your time. I know you all are busy, successful people, and I am so grateful you made the time to share this knowledge with us. And you're doing such inspiring and change-making work, and New York City is very lucky to have you. And I feel grateful to have you as collaborators and partners in this field. So big virtual applause for our panelists. And now we'll be switching gears to our presentation, followed by Q&A.
Thank you so much, Emma. I dropped my email. If anyone has any questions, please feel free to reach out. I have to hop off, but thank you so much for having me. And it was great building community with all of you.
Yeah, let's do this again, as Lisa said. I would love that. Thank you, Kendra. Thank you, Darren. So now we have Terry Power, who is also from CSH, one of my colleagues, but with the Ohio office. So let me pull up her PowerPoint for everybody. There we go. Are you all seeing my screen?
No.
Okay.
I do want to take this minute, though, to thank the panelists as well. You guys were amazing. I applaud all you're doing, and everything you said is true. And so it's a great way to follow up, because of the barriers, the challenges, all those things that you suggested, recommendations, how to work with landlords. I'm just going to validate everything you said with the program that we run in Ohio.
Yes, we will be able to hear from Terry firsthand on what community collaboration and some of this work and suggestions that the panelists gave. We can see how that worked out in Ohio. So I want to introduce our presenter here, Terry Power, who joined CSH in December 2012 as Senior Program Manager and was promoted to Associate Director in 2018. Terry Power has 35 years of experience in providing and supervising high-quality services in a variety of social service settings, with an expertise in program analysis, expansion, quality improvement policies and procedures, and Medicaid billing requirements. As the Associate Director for CSH's office, Ohio office, Ms. Power monitors, manages, and expands a statewide reentry supportive housing project called Returning Home Ohio, which we'll hear about today, and a local county justice supportive housing initiative for frequent users of the jail. And prior to joining CSH, Ms. Power directed services across multiple cities in Ohio and family, permanent supportive housing, single adult transitional housing, and emergency shelters. And Terry has a Master of Social Work degree from the Ohio State University and a Bachelor of Arts in Psychology from the University of Steubenville. And she holds an independent social work license with a supervisory designation. So she is a busy CSHer. And with that, I will let you have the mic. Terry, thank you.
Thank you very much. Okay, so you can just go to the next slide. I wanted to make sure, and the next slide after that. I wanted to make sure that we all understood what supportive housing is and what I will be referencing. Some of you mentioned some rapid rehousing. I know Lisa mentioned Housing First, which I was really glad to hear. But when I talk about the programs that we run in Ohio, it is supportive housing. And what we mean, and what I mean when I say that, is it is non-time limited. So it is housing, as we at CSH like to say, it is a housing subsidy for individuals who can't afford their rent to obtain rent. And it is, it has supportive services wrapped around it for individuals who can't maintain their housing. So it's a subsidy to obtain housing, and it's services to maintain. And I loved what Lisa said several times about working with landlords and advocating and responding to issues, which I'm going to talk about in a minute, because that is really crucial. Services need to be robust and need to be coordinated. Again, I think that was mentioned a lot. We can't do this work alone. One case manager can't be all things to their clients. And as we heard and as we know, clients are all different. They're unique, their needs are different, their strengths and assets are different. And so it's really important for us as that coordinator piece, which I like to call the case manager, is that coordinating, that glue that keeps all of the services together for these clients. It's important that we coordinate and make sure that we have those resources for our clients. So next slide. Very high level, Ohio, and I'm sure the team in the Eastern region, in the metro region, also does training on Housing First, but we provide a 2-day training actually on Housing First. So this is just to highlight the core ingredients. We follow Dennis Watson's core ingredients to Housing First. He did a lot of research around it and discovered that if you have fidelity, so if you follow to the way it was supposed to be implemented, and you follow these core ingredients, that you will have the outcomes that you're supposed to have in a Housing First program. But that's the key, is that you have to run these to fidelity. It's centered on consumer education and choice, and we know individuals in prison don't have any choice. So that alone, there's been a lot of research on just the power of that alone. So it's really centered on that. And that takes a lot of skill and training for staff to know how to do that. It's low threshold admissions and targeted housing, which in the program that we run in Ohio, we don't follow Housing First quite to that fidelity, because we don't work with people on the street. They mentioned a lot in the panel about HUD definition of homelessness. We don't have to follow that, and we don't follow it because people leaving prison are not considered chronically homeless. But we do have a targeted case, focused target population that I'll talk about. Voluntary services, but robust. It is incumbent upon case managers and staff to find out what motivates these people, what motivates your clients, and to make sure that that's what you're doing to help them follow their goals. It promotes housing retention, so at all costs, that's what we want to do. We do give people second chances in returning home, and I'll talk about that as well. It also separates property management and services. So you want your landlords and your property management doing their thing in their lane, their role, and you want services doing their role in their lane. You want them moving in the same direction, as I like to say, but in their lane. If you work with private landlords, it's a lot easier to do that. If it's all in-house, it's a little bit harder. And it embraces a harm reduction approach, which we're not going to talk about necessarily today, but again, super important for staff to have training on what harm reduction is and to implement that to fidelity as well. Basically, we are trying to keep our clients alive and well and engaged with us while they reach their goals or work on their goals. Okay, next slide. So incorporating it, it's more practically, these are the goals that we have in our program that I would hope that you could have in any program that you run. Client choice, as I said, and input is powerful. When they have that control and can decide and choose for themselves, there's so much empowerment in that. Individualized service plan. So you want to make sure that each service plan is goal driven by the tenant. What is important to them? This takes time and patience. If you've been in prison for years, if you've been in and out of jail, in and out of hospitals, you're not thinking about what's important to you. You are surviving day to day. If you've been on the street for years, you're surviving day to day. And Kendra talked a lot about how that is. You can see from her story, and as she went from person to person and couch to couch, she wasn't really thinking about, geez, what's my future going to look like? It was day to day. So it's important that we help our clients process, give them time to process, give them those opportunities to process what's important to them. Housing retention, as I mentioned, so we do allow for rehousing people in returning home, and in the other program I'm going to talk about. If sometimes there's a new way of looking at things, a second chance, a new start with a new landlord or a new area. So we do allow that to prevent an eviction on their record. We will negotiate with landlords to have this person leave voluntarily, and we find them housing again. Obviously, you want to avoid reincarceration, which is talked a lot about with our clients, and increase skills. You know, I think that was also talked about in the panel too. We don't know the skills that our clients don't understand. We can never ever assume that they know how to do something if they don't. So just always start from that basic. Let's start from the beginning and how to do these important life skills. Okay, next slide. I think the panel did a really good job of answering the question, why do we focus on housing for justice populations? I couldn't even answer it any better than you already did, but you talked about the cost. It is definitely more cost effective to house someone. It decreases the discrimination for communities of color and BIPOC communities that we have experienced since the beginning of this country. There's also a lot of research around people with mental illness stay longer in jail. They have more jail arrests, but even within their jail stays, they are kept longer, so their jail days are longer as well. I usually talk about a win-win-win with doing housing for people with incarceration. And the first win would be the cost effectiveness that was already highlighted, how much cheaper it is for people to be in housing than in jail or prison. It improves the quality of someone's life. I think it would be difficult for anyone to disagree that that's important for us. It also increases success for people leaving incarceration. It increases their success for community integration, which then impacts community safety in a positive way. So I usually use those three win-win-wins, but Darren also made me think about the fourth win now, and that is it also impacts families. So thank you for that. I'm going to include that now. So now we've got 4 wins in terms of why we should focus on housing for justice populations. It would be hard to argue with any of those. Next slide. I'm going to talk a little bit about housing models. Again, they were mentioned in the panel. There are scattered site, single site, and master leasing. So in terms of, I'm going to start on in the middle. Single site would be your facility-based one building programs. Services are usually on site. So services come in, you have some staff that are on site all the time. Then you have other staff, maybe nurses, psychiatrists, counselors, different groups that may come in and out to that building. Some buildings have 24-hour security. Some don't, depending probably on their funding level and their target population in the building. I would never recommend that you have a whole entire building of people who have justice involvement or have come from the criminal legal system. I think Basma already talked about that as well. But I think there are some individuals who need more support than perhaps a scattered site model. So it should be something that you can consider if possible to put someone who maybe their life skills are a little less, they need a little more supervision, they need maybe more security, more help and assistance, could go into a single site. Scattered site would be working with your private landlord. So you have someone leaving incarceration or leaving hospital or jail, and you as the staff person or the agency working with them, find an apartment for that person. You work and advocate with landlords. Lisa had already mentioned the importance of timeliness in response to landlords. I'm going to highlight that in a minute in the next slide, but it is partnering with those private landlords. We have clients sign their own lease with the landlord. Our program pays the rent, so we have a separate agreement with the landlord, but our clients just sign a lease in their own name. Again, we feel that that's very empowering to them to have the lease in their name. It gives them the rights and the responsibilities, both of all of the tenants in that lease. So they have to abide by all of those rules that are in the lease. But their lease looks like everyone else's. There's no program addendum that they have to do in order to stay housed. Their lease looks just like their neighbor and anyone else. And then you can master lease. So you as the agency can sign the lease with the landlord. And then the client in turn signs an agreement with you as the agency. So it's sometimes called an occupancy agreement that you as the agency have with the client. But the master lease is with the agency and the landlord. Some advantages to that would be, I think as Lisa mentioned, that it is guaranteed rent, that the agency holds the responsibility maybe for the unit, maybe for damages in the unit, maybe for maintenance in the unit. So it is a little more appealing to landlords, a little riskier for the agency though, because you're out if something happens. So agencies need to think really carefully about that if that's what you want to do. You can use any combination of these as well. So if there's a landlord that isn't sure yet, you can maybe master lease until they get some experience with your clients, and that's also an option. Okay, next slide. So how do we address the criminal backgrounds? A lot of you mentioned it follows you, unfortunately, your whole life sometimes. And those partnerships with landlords are really important. There's a lot of work that gets done with our staff in terms of those landlord partnerships and landlord relationships. So working with them is really critical. The advocacy and relationship with the landlords is really, really important. Educating them about what the program is, trying to debunk their myths and stereotypes of the individuals that we're serving, because they probably have one stereotype. I think as Kendra mentioned, especially if someone does have a violent history or is in prison for murder, she's right about that recidivism. It's very low. It's usually those people who have substance use issues and have the misdemeanors that are the ones that are higher risk for reincarceration. So just debunking some of those myths, making sure that they understand there is someone to call, and being responsive when a landlord does call. We get a lot of positive results from saying to landlords, hey, you have us to call. You have many other tenants also have issues, and you have anybody to call. So we get really a lot of traction with that selling point with landlords. And then once you find a good landlord, what we like to call second chance landlords, landlords that have compassion, that really want to partner with you, they're the best referrals to other landlords. They usually know other landlords that are also second chance, that also care about people. And as we know, there's many buckets of landlords and developers and real estate managers. And so we want those people that care about their tenants. And that's a good doorway, a good open door to other good landlords. So I'm going to talk a little bit about our program in more in detail. You can go to the next slide. But one of the things we do, so as Emma mentioned, I work with a statewide program, Returning Home Ohio, and then I also work with a local program, local to Columbus, Ohio, with frequent users of jail. So in both of those programs, it's important for the staff to partner with probation and parole, really to partner and coordinate with all community. All community resources, all behavioral health, substance use, AA, life skills, employment, vocational, all of those things. It's really important for our staff to know the community resources in their particular community. But we have an added responsibility to partner with probation and parole. One of the things that CSH does across the state on a higher level is continuing to educate parole, probation, and the DRC, the Department of Corrections staff, on what returning home is, what it isn't, what we do for clients, and what to expect from us. So we can partner with them, but we also are not, as I call, mini probation officers. So it's not our job to tell to probation officers what our clients are doing. So we don't say it quite in that way, but what we say is we have a very important relationship with our clients built on trust, and that is the foundation, and we can't put that trust at risk if we begin to become the conduit of telling probation everything our clients are doing. So we have a different relationship with our clients. It's important for parole and probation to know that and understand that, and to understand the importance and the core ingredients of the program that we run with them. But again, it's a fine balance, because we also want to partner with them. We want them to see things a little bit more through our lens, with a lens of compassion and second chance, and not with that lens of looking for something to go wrong with this person so I can violate you and send you back to jail. So we want to help to change their perspective a little bit, and looking at this person a little bit differently, with a little bit more compassion as a real human being with abilities and strengths. And each probation officer is different, so you have to work with them, from where they're at and how they understand their people. And so it doesn't mean that we don't have difficult conversations with our clients, and that we try to help them understand the responsibilities of their parole and what will happen if they don't do that. But we work with our clients on those issues. Okay. So one of the ways that Returning Home started, so Returning Home started in 2007, so it's been ongoing. And I think it was Darren who mentioned that supportive housing for people in incarceration hasn't always been the way. So way back when, it was really new in 2007. And so we worked with the Department of Corrections to look at where were the gaps. So there is some research done with halfway houses, correctional-based community-based correctional facilities, which is what CBCF stands for, which is where people sometimes go to live out the rest of their sentence in a more treatment-oriented way. Halfway House also offers some treatment recovery houses, the sober living, plus high-level best practice motivational interviewing does equal reduced recidivism. The problem is there's many people who don't complete those programs. But for people who do complete, then the research shows that they do well, but they are leaving a lot of people to the side. So we want to look at the strong benefits of supportive housing, which remember is non-time limited. The other issue with Halfway House and CBCF is they're time limited. So here's who we are in Ohio. We have Returning Home Ohio, which is the program I run, which is funded 100% by the Department of Corrections. We have the CTP, or Community Transition, which is funded by the Ohio Department of Mental Health and Addiction Services. And then we have FUSE, which is Franklin County, Columbus, and funded by the Franklin County jail system. Actually comes from the state to the county. The Returning Home Ohio program's target population are those with a severe and persistent mental illness or are HIV positive. Community Transition focuses on those individuals who have substance use disorder and participated in recovery service while incarcerated. So they have had to have that recovery service. And then FUSE is those people who are frequent users in and out of jail. There's certainly everyone who leaves prison and jail could use help with community reintegration and housing, but these are who we work with and as a community. I would go into more detail, but I know we're short on time. So just a quick about Returning Home Ohio. From 2007 to 2012, it was a pilot. The Department of Corrections agreed to run it as a pilot. They were very uncomfortable with this whole idea of non-time limited. So they agreed to work it as a pilot. And CSH really, quite honestly, the first time they embarked on using supportive housing as a tool for people entering from incarceration. During that pilot, the Urban Institute out of Washington, D.C. studied it. They had a comparison group and a treatment group. So they had two groups of people that looked like each other. And they found that the people who were in returning home were 60% less likely to be reincarcerated. In addition, they had 290% increase in behavioral health utilization as measured by Medicaid billing. So the fact that they had a case manager there with them from the beginning through when they were ready to leave really shows that it helps people become interested in housing and interested in services to help themselves. That was the beginning. Then in 2012, because of the good results of the evaluation, the Department of Rehab and Corrections in Ohio made it an ongoing program. So next slide. So we're actually written into their, what they call their policy on placement. So if a case manager in an institution was to look for what do we pay for? What does the Department of Corrections pay for in terms of placement for this person? We're in that policy. So it's really fantastic. Recidivism to state prison for this last program year, and it has been anywhere between 4 and 6% since 2012. So for those exiting the program, 4% of them exited to prison. I think if we included jail in that, it may increase to about 10%. It was discharged. So we don't do a look back. We don't necessarily have the ability to look back on those people, but when they exit, 4% of them have exited to prison. 77% engaged in mental health, 48 engaged in substance use, which is, I think, really great. Having been in the behavioral health field for many years, this is a pretty high statistic. we serve a range of risk levels, and I don't mean risk level in terms of suicide or mental health assessment. I mean risk level in terms of recidivism. Ohio is one of the states that use a risk assessment tool done by the University of Cincinnati that actually measures you at risk of recidivism based on 7 domains. It's not the most perfect tool, but it is standardized, and we accept all people. So it's low, medium, or high based on that. Our average length of stay is 29 months. Now, remember, this is a non-time limited program, and we've been measuring length of stay since July of 2012. I'm going to also tell you that a year ago, it was about 20 months, or actually 2 years ago. So I feel like the increase may be due to COVID, because no one was getting evicted, as I think Lisa pointed out, no one was going back to prison. And so the Department of Corrections and landlords are really focused on keeping people housed. So I'm anticipating that 29 months will probably decrease again. And not everyone is on the parole or probation. Okay, next slide. Community Transition Program is the next program I want to talk about. That was launched a little later. And because of the success of Returning Home Ohio, the Ohio Department of Mental Health and Addiction Services wanted to replicate that using money through when Ohio had what I call opioid money. So they sued the pharmacy, and there's a lot of federal money coming in for drug addiction and prevention. And part of that, the state decided to put toward housing, which is fantastic. So these are some of the statistics for CTP. Again, very as successful as Returning Home. What CTP has included that Returning Home didn't and doesn't is the rapid rehousing piece. So they do a tool called the SPDAT, which is basically a housing assessment that assesses risk of homelessness. And if you have a lower score, then you are referred to rapid rehousing, which is a 4 to 6 months. I think they actually just increased that to 12 months, but it's not a permanent non-time limited housing. It is time limited, and it's really focused on employment and self-sufficiency. If you score higher on that SPDAT, then you're referred to permanent supportive housing, which means that you're more at risk, you have more behavioral health issues, and you're more at risk of homelessness, and you have more of a history and need additional support. So based on that, that's how it's decided, where you go. Same concept as Returning Home. Every client has a case manager. That case manager is responsible for making sure that they coordinate services for that person, that they find out what their goals are, same voluntary services. All of those core ingredients in a model are really the same for community transition. And then quickly, I don't have a slide on FUSE, but because I mentioned it, it is, so there's lots of information on FUSE, F-U-S-E, on our website, and I'm sure Emma and Lauren can steer you in that direction. It is for frequent users, so we are targeted toward the frequent users in that community. Every community identifies and defines their frequent users differently, depending on how many people live there, how many people are in jail, all of the political will. So each community defines frequent users differently, and then provides the same supportive housing, same non-time limited supportive housing, scattered site normally uses, and wraps those services around them. So same concept, but a little bit of a different target population with the frequent users. And normally they're frequent users because of homelessness and mental illness and drug addiction. So really high level, and I kind of quickly went through there.
No, that was perfect.
Maybe take a couple questions.
Yeah. Let's see. And I know we had a question in the chat. I don't know if it's New York City specific, but if you might be able to speak to it as well, Terry. Let me pull it up. So in the case that existing landlords do work well with tenants and are interested in supportive housing, in New York City, it's really formatted that it's hard to get clients into supportive housing. It can be difficult due to all the surveys and eligibility requirements and getting through coordinated entry. And landlords don't typically have resources to get through that. And then sometimes even house clients with carceral histories. So how can we work on this type of issue was the question that I got from the chat from Jomo McLean.
Yeah, I'm not sure. Hopefully I understand the question. I think that with returning home, we just work with private landlords. So because I think part of it is maybe where your funding comes from. We don't work with the continuum of care, and we don't work with coordinated entry, and we don't work with HUD definitions because we're funded by the Department of Corrections. I think Emma mentioned some of the funding that you have is city funding. And when you have even state funding, you can make your own definition of homelessness. You do not have to follow the HUD definition. So we don't have to work with coordinated entry or housing vouchers. We like to get our clients on housing vouchers. So we always sign them up if possible once they're good clients for several years, depending on the county in Ohio. Some housing authorities are more liberal and progressive than others. So we try to work with them individually to get some of our clients on the list for a housing voucher. But we don't have to do that. And I do also know that we have institutes, that CSH runs institutes on how to build supportive housing. So if you want to build supportive housing and maybe have people, a few of the units set aside for justice involved individuals, that's another option. But working through the continuum of care and coordinated entry would be definitely a coordination among your systems that would need to happen.
Yeah, if there are any folks, New York City folks that are interested in CSH as a supportive housing institute, please email myself, email me, and I would love to share more about that. That's a good question. I also wonder, Jomo, I don't know if you saw in the chat, Terry, and I don't know if it's an easy one to answer.
Yeah. I mean, I think it starts with coordination, and I think Lisa kept referring back to that too. You need to get systems talking to each other. So that's how.
Yeah, I mean, you're a little.
Yeah,
Terry, you're a little bit more centralized, which is great because you're dealing with one entity, which is great. And you could do a lot more and be more creative when you're dealing with it. So these programs have different funders. And, to be very honest, sometimes I think the city makes it harder than easier. So in return to your question, I think the gentleman who's asking the question, I think what you try to do is we take some ideas, because I like your presentation is excellent. It seems very focused. And I think sometimes with CSH and DOHMH, sometimes I think, and not CSH, I think you're very supportive. I think sometimes DOH has to relook at this program and say, oh, what can we do a little better? Sometimes we get strict on certain things or not really thinking outside the box of what could work a little better, whether it be having a little bit more funding for apartments. So if you're only given a certain amount of money for apartments, you tend to have to, like I said earlier, get 4 or 5 apartments from one landlord who'll give you a price because it's mandated and will give them money. But if they only have one here and there, and we try to stay away from 2 bedrooms because we find 2 bedrooms creates more problems for the clients, which is bizarre, but true. I mean, they have a tendency to be more complicated. We find that if you do 1 bedrooms, even though 2 bedrooms can be cheaper, it doesn't really work in the long run. So I think all those things are important. But again, I think we have to think outside the box and kind of say to the city, look, I think this might work better or this might work better. And sometimes we're slow in making the changes. So that's what we got to keep working on.
Yeah.
That's great. I know we're at time. So to our attendees who have to hop off, thank you so much for attending today.
Thank you very much.
And Camila, if you want to say a few words. I know Terry is able to stay on for just a few more minutes if you have some more questions. But before that, we do want to give a big thank you. Camila, I see you up there.
Yeah, thank you everyone, to all the speakers, and Terry for highlighting some of the different models that other places are using to house this population is really informative. And yeah, I'm just putting in the chat the link to our next session, which is really going to dive a little deeper into navigating the New York housing regulations, which can be very complicated, especially if you're looking to house this population. So we'll really go into detail there regarding the law. So yeah, there's a registration link, and we'll follow up with the recording and presentations used during this session.
Awesome. Thank you.
Thank you, everyone.
Any more questions? Or Terry, did you want to speak any more to that last one?
So, Jomo had a question about how can you replicate it, and I've been asked that. I've gone to many different states and jurisdictions talking about returning home Ohio, and I think you do need to get all of these systems talking to each other firstly. And I do know New York City Housing Authority is pretty progressive and willing to talk, and they did the full family service program there, which has gotten great results, and I can't remember who, I think it was the Vera Institute who researched it and evaluated it, and you can certainly start there. They showed some really great results in their program. But it does start with funding and big systems getting together. In Ohio, the Department of Corrections believes in rehabilitation. Not every Department of Corrections does. They only believe that they should fund people when they're in prison. So that's a difficult hurdle to come across. But if you have data, that certainly helps with the cost. That data with Rikers is remarkable, and I don't know who can ignore that.
Yeah.
So the SPDAT is, Emma, are you familiar with the SPDAT? It's a tool, homelessness tool, so she can share that with you. I think that's what you mentioned. Is that what you're?
No, I was talking about the coordinated entry, like supportive housing survey, but I also am familiar with the SPDAT.
I'm not sure, Jomo, if I don't know that I said 7 domains, but I might. He means the risk assessment. I can share that with you. So it's called the Ohio Risk Assessment System, ORAS for short. That's the 7 domain. It measures the risk of recidivism, and you get a low, medium, or high score. And it's usually administered by the Department of Corrections staff, not outside people.
Yep. Y'all can come off mic too. We'll do just a few more minutes if anything else. Or we can close it here.
Thank you, Leslie, for that comment. I'm sure it's very difficult, and returning home doesn't exclude anyone. So a little bit more difficult to find housing for some people than others.
Awesome. So we have a couple emails in the chat, myself and a few of the panelists, and the registration link for the next session. And a big thank you again to Terry Power for your great presentation and for sharing with us how we can bring some knowledge from other communities into our own, and to push the envelope with some of these awesome suggestions, and taking also the great experience and stories we've heard from the panelists and filtering that through our work too. And with that, I want to thank you attendees for coming today and for your time. I know it was a longer session. We appreciate you so much. See you next month.
Thank you, everyone. Keep up the good work.
Bye, everyone.
Don't give up.
Yeah.